So before starting my head-to-toe assessment, I went ahead and I washed my hands for 2 minutes. I gathered my stethoscope and my pen light, and I also checked his vitals and measured his BMI. His BMI was about 26.2. So the next thing that I'm going to do is I'm going to go ahead and introduce myself to the patient and explain to them why we're doing a head-to-toe assessment. So, hey Ellis, my name is Mary and I'll be taking care of you today. So I hear that you need a physical for your soccer trials, is that correct?
Yes.
Okay, so today we're going to be doing a full head-to-toe assessment so we can clear you for soccer, okay? Alright, so after doing that, I can go ahead and start my general inspection. So the first thing that I'm going to do, I'm observing his posture, I'm observing his physical color, symmetry of his upper extremities and lower extremities. I'm going to ask my patient a few questions so I can see if they can speak and understand me as well. So, do you know where you are today?
Yes, in my room.
You're in your room. Do you know what time it is?
3 o'clock.
3 o'clock. And do you know what day it is?
Monday.
Monday. So, with asking him a few questions, I know that he can understand me correctly and also can assess his level of consciousness, and he seems very alert. So now I'm going to ask you to just walk to me. So can you walk to me? All right, can you turn around? And can you walk back and then sit to where you were sitting? So when I was doing that, I was making sure that he could comprehend what I was saying, he can follow directions, and he can also show me how he walks, so I can observe his gait to make sure that there's not any problems with that. And I'm also observing his posture and making sure there's no limps or anything. So moving on from the general inspection, I'm going to now start for the head and the hair, or the head and face inspection. So the first thing that I'm going to do is I'm going to start off with the head area or the hair. So I'm just looking at his hair. He seems very clean. He's very hygienic. It looks like that he's dressed appropriately. His hair is blonde, and I don't see anything out of the ordinary. So now I'm going to go ahead and look through for any lesions, and I'm going to palpate. So he does have a few dry areas, which he can fix with some shampoo and conditioner. Do you have any tenderness?
No.
You don't have any tenderness? And his hair seems pretty coarse. So the next thing that I'm going to do, also for his hair, I didn't see any lesions or cuts, which I would have to document, but he doesn't have any, which is great. So now I'm going to look at his skin complexion. So he's got a light tan. He has a few blemishes, but he told me that he's 15 years old, so I know that's just from hormonal changes. And I'm going to palpate his skin to make sure that he's got adequate warmth, which you do. We don't want a fever, and we don't want to be too cold or clammy. So after doing that, I'm going to palpate the temporal pulses. I'm going to make sure that his pulses are clear and they have good amplitude, which they do, so they're 2+. Now what I'm going to do is go over the bony prominences to feel for any tenderness. Do you have any tenderness?
No.
Nope? Okay. So now what I'm going to do is I'm going to assess your TMJ joint. So can you open? Can you close? And then you can bite down. So I was assessing to make sure that there's not any crepitus, and also when he bit down, I could tell that his masseters are working correctly, so cranial nerve 5 is intact. So the last thing that I'm going to do is, can you smile? Can you frown? Can you puff your cheeks out? And can you move your eyelids up? Perfect. So he can do all those facial motions, so that's testing cranial nerve 7, everything looks intact. So moving down to the eyes. So the first thing that I'm going to do is I'm just looking, so can you look at me? So I'm looking at his eyelids, and they seem very clear. There's no abrasions or anything. His eyebrows, he's got full, thick eyebrows, which are really nice, and he's not missing any hair. And so now what I'm going to do is I'm going to inspect the sclera. So his sclera is white, his iris is green, pretty green eyes, and so they look just like mine. So now what I'm going to do is I'm going to look at his cornea and make sure there's not any abrasions. So can you look straight for me? Okay. And then look straight. So I was looking at his cornea to make sure there's not any abrasions or any hemorrhages. So also I'm going to inspect his conjunctiva. And his conjunctiva are pink and moist, and there's nothing of my concern either. So now what I'm going to do is there's about 5 tests that we're going to have to do. So the first thing that I want to do is just go ahead and test cranial nerve 2. So I'm going to do peripheral vision test, and I'm also going to do the Rosenbaum. So what I need you to do is cover your right eye or your left eye, whichever one you do, right? So we're going to start off with right, and can you read the lowest line for me?
428365.
Okay, you're gonna make sure that it's about 14 inches away so you can't move.
Sorry.
No, you're good. So can you do the left eye as well?
428365.
Okay, perfect. So he has 20/20 vision with his right and left eye. He does wear contacts, so I would have to document that as well. So 20/20 vision with contacts. The next thing I'm gonna do is test his peripheral vision. So when you can see my fingers, just say yes, but look straight at me, okay?
Yes. 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 Yes.
Okay, perfect. So I know that his cranial nerve is intact, so that's cranial nerve 2. So we assess that. So the next thing that I'm going to do is the corneal reflex. So I'm just going to shine right in the middle of the nose, and I'm looking to see that both eyes are symmetrical, which they are, and the right eye does the exact thing that the left eye does. So now what I'm going to do is test pupillary response, which is testing cranial nerve 3. So I'm going to shine a light in his left eye or his right eye, and whichever, let's say I start with his left eye. So I'm going to make sure that his pupil constricts, and then I'm going to pull the light away, and then the next time I put it in his left eye, I'm going to look at his right eye to make sure that that pupil constricts too, because whatever the right eye does, the left eye should do as well. So I'm going to go ahead. Can you look at me? Okay, it constricts. And then I'm going to look at this right eye, and it constricts as well, which is good. Do it again. His right eye constricts. And his left eye constricts as well. So that is pupillary response, and that's cranial nerve 3. So the last thing that I'm going to do is assess cranial nerves 3, 4, and 6. So I'm testing for lateral movement and upward and downward movement. So can you follow the pen, but don't move your head? Okay. And his cranial nerves 3, 4, and 6 are intact as well. So his eyes are clear. So now we're going to move down to the nose and the ears. So I'm first going to start with the ears. So I'm just going to look around and make sure that I don't see any lesions, any redness or erythema. So now I'm going to feel and palpate for any masses or tenderness. Is that tender?
Mm-mm.
Not tender? Okay, perfect. Now I'm going to look in with my pen light. I'm looking for any discharge. He does not have any, which is great. And the last thing that I'm going to do is I'm going to test his hearing. So I'm going to do something called the whisper test. So do you remember the whisper test when we did last time?
Yeah.
So I'm going to have you occlude your left ear when I go to the right, and then your right ear when I go to the left. So I'm going to whisper 3 words, and you're going to have to repeat back to me, okay?
Mm-hmm.
So can you occlude? Okay. Dog.
Dog, cat, dog.
Okay. Can you occlude the other? No, can you occlude? Yeah.
Go find you.
Yeah, we gotta go find you. Okay. Okay, so that was testing his ears, and his ears seemed perfectly fine, and he could hear and understand what I was saying with the whisper test, which is great. So now we're gonna move down to the nose. So I'm just gonna inspect the nose. I'm looking for any lesions, any crustaceans, and I don't see anything. I'm going to palpate to make sure there's not any tenderness. Is there any tenderness?
Mm-mm.
Nope. Okay. So can you lean back? So now I'm going to look at his septum and make sure that that's not deviated and that's a line. I'm looking at his mucous membranes in his nose. I'm making sure that there's not any discharge, and I'm inspecting the nares. And everything looks great. So the last thing that I'm going to do for the nose is I'm going to test his patency. So I'm going to have you occlude one nostril and breathe in, and then occlude the other. And could you breathe well? All right. So that's great. So his face, his hair, his ears, his nose, and his eyes are all intact, and everything is great. So that's looking good so far. Okay, so now we're going to move down to the mouth. So before I have my patient open the mouth, I'm just going to look around the mouth, make sure that he doesn't have No, before
Oh,
I.
sorry.
No, you're good. So before he opens his mouth, I'm just gonna look around his mouth. His lips seem very moist; they're not dry, which means he's well hydrated. Good job. He doesn't have any crustaceans or lesions that I should document, so that's great. So now I'm gonna have you open your mouth for me. Just stick your tongue. No, stick your tongue back in. Okay, so I'm just looking around. I'm looking at his buccal mucosa. I'm looking at his hard and soft palate. I'm also looking at his oropharynx, and I'm making sure that there's not any odor, there's not any lesions. He's got all his teeth intact, which is great. He's got all the numbers. Yep, that's your soft palate. That looks great. So now what I'm going to do is I'm going to test cranial nerve 9 and 10. So I'm going to have my patient say ah, and I'm going to look at his uvula and make sure that that goes up and down when he says ah. And I could test gag reflex, so I'm going to do that as well. So you say ah. And I'm going to grab a pencil or a pen because I don't have a tongue blade. So I'm going to go ahead and say ah. No, I'm not going to stick it back, I promise. So look at there we go. So I'm looking and his uvula goes up and down. His gag reflex, yeah, so his gag reflex is intact. So that's cranial nerve 9 and 10 that I did. So now can you, wait, let me look at your tongue. So his tongue is nice and pink. It's not swollen and he doesn't have any ulcers or lesions on that, so that's great. So the next test that we're going to do is testing cranial nerve 12. So can you put your tongue to the side of your mouth? On the other side? Okay, and he can do that, so that's testing cranial nerve 12. And now I'm going to have you swallow. Do you have any difficulty swallowing?
No.
Nope? Okay, so that's testing cranial nerve 5, 7, 9, 10, 11, and 12 when he swallows. And everything was intact and he had no difficulty swallowing and no pain swallowing as well. So now what I'm going to do is I'm going to palpate his lymph nodes, and I'm going to make sure that they're not palpable and I don't feel any masses, and there's also no tenderness. So report any tenderness, okay? So I'm going to start off with the preauricular, your postauricular, your occipital, okay, your tonsillar, your submandibular. Do you have any pain?
No.
Okay. Submental, and then sublingual. And you had no pain.
Mm-mm.
All right, perfect. So now we're going to move down to the neck and shoulders. So I'm going to go ahead. I usually would just do a general inspection of his neck, but I'm going to go ahead and finish off the lymph nodes. So I'm going to finish the anterior cervical chain, the posterior cervical chain, the supraclavicular, and then
Sorry, tickles.
no, you're good. And testing the infraclavicular as well. And you have no pain.
No.
All right. So the next thing that I'm going to do is I'm just going to inspect his neck. He has no discoloration. He has hair, but that's just because he's shaven now. But it's clean cut. It's not out of ordinary. He's got a few freckles, but nothing that seems malignant that I need to document. Okay, and so now I'm just going to palpate. I'm also going to feel the warmth, make sure he's warm. So now I'm going to palpate the trachea, and then palpate, I know it tickles, palpate your thyroid. He does have hypothyroidism, so it's always a good thing to palpate his thyroid because we want to make sure there's no goiter. Okay, and so now what I'm going to do is I'm going to test the carotid pulse, but I'm going to do this one at a time. I'm going to make sure that these are 2+, which they are. They have normal rhythm and amplitude. All right, so now I'm going to test, I'm going to test cranial nerve 3 by feeling, wait, put him down, by feeling his shoulders. So can you pull him back up? Perfect. So I was testing cranial nerve 11. Okay, so can you go up with your neck, go down with your neck, look to the right, look to the left, side, side. Okay, so I was looking at his range of motion with his neck, and I'm also going to do that with the shoulders. So I'm going to do passive, and then I'm going to do active. So passive, I'm just going to do this. I'm going to make sure that I don't feel any crepitus at his shoulder joint. I'm going to do the same at on the other side. Okay. So now, can you do this for me? Go backwards, and then can you go frontwards? Do it one more time.
Oh, sorry.
No, you're good. So did you have any pain with that?
Yeah.
Okay, perfect. So moving on from the neck and shoulders, we're going to go down to the arms and hands. So first thing that I'm going to do is I'm just going to inspect. His right and left arms seem very symmetrical. He's got optimal hair growth. He's got a few freckles. He's got a light tan. You use sunscreen, right?
Yes.
Yeah, it's very important to use sunscreen. So now I'm just going to check his warmth. Okay. He seems very warm. He's not too cool, not too clammy, and he's not too hot. I'm also going to test his edema. And then I'm going to assess tinting. So I'm going to assess his skin turgor to make sure there's not any tinting, which there's not. It's very elastic and he's very well hydrated. Okay, so the next thing that I'm going to do is I'm going to look at his fingernails. So I'm going to inspect his fingernails and I'm looking to make sure that they're clean cut, they're not dirty, there's not any lesions around them like hangnails that can be painful, which there's not. So now I'm going to do capillary refill for each finger. And the fingers should rebound in less than 3 seconds, and it looks like his are rebounding fairly quickly, which is very good. So now, can you do this for me? Okay, so I'm looking for clubbing of the fingers, and he does not have any, which is also a good sign. So I know you hate this, but we're gonna do the brachial pulse. We're gonna assess those. And those are 2+. And then I'm also going to do radial. And those are 2+ as well. Alright, the next thing that I'm going to do is I'm going to have you do some active and passive range of motion. So first we're going to start with passive. So I'm going to make sure at his elbow and wrist joint that there's no crepitus or any popping and there's no pain. Okay? And there's no popping, which is great. So now we're going to do some active. So can you do this for me? Do that. And then can you do this? You go up. Can you go down? All right, perfect. So his range of motion is great. Now we're going to test his muscle strength. So I need you to do this for me. So pull against me. Okay, pull towards you. Okay, you're really strong. It's gonna be good for soccer. Okay, and can you pull on my fingers, like pinch them? Perfect. So his muscle strength is 5 out of 5, which is perfect. So now we're gonna move on to the chest and the lungs. So the first thing that I'm gonna do, usually my patient would not have his shirt on, but for this video and for this video purpose, we're just gonna have his shirt on and pretend there's not one. So I'm first looking at his posture. I'm looking at any lesions or any moles that I need to document. I'm looking for retraction, heaves, thrills, pulsations, paradoxical movements. So I'm looking at all of that. Okay, I'm also making sure that everything is symmetrical and his posture is correct. So now what I'm going to do is I'm going to listen to 8 spots for his lungs on the front. And then I'm also going to listen to his heart. And then we're going to flip around and listen to the lungs posteriorly. So the first thing that I'm going to do is obviously get my stethoscope. Okay. So I'm going to start at the apex of the lungs. I'm going to start right here. I'm going to listen for any adventitious sounds. Wait. Actually, before I do that, I'm going to feel his bony prominences so I know where to put and listen to his lungs, put my stethoscope. So I'm going to feel his clavicle, his sternum.
Sorry, I'm right
So
there.
you're good. Do this. And then his ribs. And there's no pain or tenderness.
Mm-mm.
He did kind of jerk when I felt over his sternum, and that's because he has a pimple. But like I said before, that's normal because he is in the age of acne, so he's 15, which is his teens. So now, after feeling his bony prominences, I'm going to go over his lung sounds, and I'm going to start at the apex of the lungs. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Okay, so I didn't notice anything out of the ordinary. So now I'm also going to palpate his apical pulse. I'm going to make sure that that is prominent. And it is, and it's normal, so it's going to have 2+. So now what I'm going to do is I'm going to listen to his heart. So I'm going to start off with the atrium, his pulmonic, Erb's point, tricuspid, and then mitral. And then now I'm going to flip over and listen to the heart with my bell as well. So, atrium, pulmonic, Erb's point, tricuspid, and then mitral. So his heartbeat seemed normal. I didn't hear any S3 or S4 sounds, so all I heard was S1 and S2, which is great. So now can you turn around for me? See if you can see. Actually, go this way. Yeah, go like that. So now I'm going to listen to his posterior lungs. So the first thing I'm going to do is obviously look at his posture, document that. I'm looking at his spinal curvature, making sure there's not any symptoms of scoliosis or anything. I'm also looking for lesions, doing everything like I did for the front. I'm going to palpate the bony prominences. Do the ribs again. Make sure there's not any tenderness. Is there any tenderness?
No.
Okay. So now I'm going to listen to 10 points on his back and then 7 laterally. I'm only going to do 4 on the right and 3 on the left because there's 3 lobes on the right lung and 2 lobes on the left. So I'm going to go ahead and listen to that. Breathe in. Breathe out. Every time I put this on you, just breathe in and breathe out, okay? Breathe in, breathe out, deep breaths. Breathe in, breathe out, deep breaths. Breathe in, out, breathe in, breathe out. So posteriorly it's clear, so now I'm going to check his lateral sides. So breathe in, breathe out, breathe in, breathe out. Can you lift your arms just a little bit? Okay. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, and then lastly, breathe in, breathe out. All right, perfect. So you didn't have pain with that? No trouble breathing?
No.
All right. So now we're going to move on. So that was the lungs and the heart. So now we're going to move on to his abdomen. So what I'm going to have you do is I'm going to have you lay down this way, actually. Okay. So I'm actually going to bring the camera with me just so you can see. I'm going to put it right here, just so you can see better. So obviously I would lift up his shirt and I would look and make sure there's not any lesions, any abrasions. I'm looking for peristalsis, or make sure that there's not any problems with his breathing or his abdominal area. So after inspecting, I'm going to listen to the 4 quadrants. Like I said, I would lift up his shirt, but for this video, I'm not going to. So I'm going to listen to the 4 quadrants for 15 seconds each. And I'm listening for bowel sounds. Okay. So after listening to all 4 quadrants for 15 seconds, I'm going to turn over to the bell and I'm going to listen to the epigastric area. And I do that for 15 seconds as well. So last thing that I'm going to do for the abdomen, so I'm going to palpate all 4 quadrants and the umbilical area to test any hernias. So I'm just palpating for any masses, and I'm looking for the patient's guarding. And can you tell me if you have any tenderness or pain?
I don't have any.
Okay. Okay. His lower left quadrant, and then his lower right quadrant. And lastly, his umbilical area.
Sorry.
No, it's okay. I know that tickles. All right. So now can you sit up for me? Okay. So actually, I'm going to lower it so you can see his lower extremities. Okay. So now what I'm going to do is I'm going to move down to the lower extremities. So just like the upper extremities, I'm first going to look and just have a general inspection like I always do. So I'm looking, he's got optimal hair growth. He has a slight tan. He doesn't have nearly as many freckles as he did on his upper extremities. He's got a few skin tags, which I would document, and that is on his left knee. So now what I'm going to do is I'm going to feel his skin for temperature. And just like his upper extremities, it's warm and it's optimal temperature. So now what I'm going to do is I'm going to assess pitting and edema. And that's very common in his lower extremities. Pitting is usually more common in the feet. Okay, I'm going to bring your feet up just so she can see. I'm also going to assess skin turgor. Okay, and there's no tinting. So now what I'm going to do is I'm going to do some passive range of motion and then active range of motion. So I'm just going to feel for any popping and any crepitus. So do you have any tenderness? No. Okay, so he doesn't have any crepitus, which is great. And he also reports no tenderness. Okay. So now, can you lift one leg up? Can you lift the other up? And down? And then up and down? Okay, now can you put your feet up? Can you flex them up? And then flex them down? Okay, perfect. And can you also go in circles? All right, perfect. Can you put them down? All right. So now I'm going to look at his his toenails, and I'm going to assess for capillary refills. So I'm inspecting his toenails, and just like his fingernails, they're very clean and well kept. He doesn't have any lesions. He does have some hair on his toes, but that is normal for a 15-year-old man or boy. So now I'm going to assess for capillary refill. It should be less than 3 seconds. They're not rebounding as fast as his fingernails, but they still are rebounding in about 2 seconds, which is great. Okay. The next thing I'm going to do is I'm going to look at his heels. I'm looking for any pressure ulcers, because usually that can happen a lot. Any skin tags, any lesions, any blisters, anything like that, which he does not have any. So I'm also going to palpate the 2 pulses on his feet. So I'm going to palpate posterior tibialis right now. So can you lift your feet up for me, please? Which his are a little hard to find. So I would probably document about 1+. They're still normal and it's fine, but they're just a little bit faint. I'm also going to do his dorsalis pedis. And those are a lot easier to find, so that's about 2+, I would say. Okay? So now what I'm going to do is I'm going to test some motor strength. So can you push against me? Okay. Can you pull towards you? Okay. Can you lift your feet up? So press down like a gas pedal. Okay. And then press up. All right. Perfect. So now what I need to do is, can you stand up for me? So I'm assessing your range of motion, your hip range of motion. So can you do a squat for me? All right, perfect. And you had no tenderness with that as well. Okay, can you turn around? So now I'm gonna ask him to bend over. Actually, stand up. So I'm going to palpate his spine first. I'm also looking at his posture once again. I'm just palpating his spine. I'm looking for scoliosis or kyphosis, which he doesn't have. So can you lean over? Okay, so I'm looking at his posture. I'm making sure that not one hip or shoulder is too high. Okay, can you stand up? Also palpating, and his hips are aligned with his, his hips are aligned with his shoulders. Okay? So I think that is it for the overall head to toe assessment. So I think that you are clear to play soccer.
Thank you.